Hello and welcome back to another segment of Inside Albany Med, and I'm joined today by Matt Phelps. Good morning, Matt.
Good morning. How are you?
I'm wonderful, thank you. So for those who don't know you, tell us a little bit about yourself. First of all, where do you work and what do you do?
So I work in the emergency department, and I've been there for 2 years. I work under patient access, so that's what I do.
Talk a little bit about what your job is and what you do in the emergency department.
What I do is, what don't I do? I do a lot of different tasks through patient access. Depending on where I am in the ER, I could be doing triaging patients, which is the first point of contact, or EMS. They're both kind of similar positions, but either spot. Registration, transitioning people to the floor, upgrading people, and just basically getting people moving, as well as updating all of their information, demographics, and making sure we have their emergency contact and all of the information for the patient.
You mentioned you work in the emergency department doing registration sometimes. Mm-hmm. For people who don't know what that looks and feels like, you're often the very first person who will meet a patient or a family member when they come in,
right,
often in a moment of crisis or what might for them be one of the worst moments of their life, and you have to get information from them. Talk about what that skill set is like to get that information despite the fact that they may be nervous, scared, or in pain.
Well, the process, like you said, a lot of times, most of the time, especially in the ED, these people are really struggling, or there's a trauma, or emotionally disturbed people, and that can be certainly challenging. I think for me, it's not to toot my own horn, but I'm an empath and I feel people's energy, so I kind of use that as my skill set to kind of see where the person is and how I need to respond to them.
Excellent.
Being empathetic with each person, because I don't know where they're coming from.
Right.
I don't know if they're coming off the street,
right,
and what's going on in their lives. So it's just really compassion. There's a reason that's part of Albany Med Cares, the first letter. I think that's really important.
I think that's a great point, and I think you're exactly correct. There's no question that as we operate as a team, we need all members of the team functioning at a high level, and that includes not only the people at the bedside who may be providing care, but everybody, including our non-clinical colleagues, part of one team. Can you talk about what your co-workers and team members are like? Some words you would use to describe the way in which you all work together.
In the emergency department, I think that's what I really like about working where I work, right, is because I don't just have my patient access co-workers, there's also nurses, there's resident doctors, the attendings, ESAs, everybody, and what I love is that we all work together.
Yes.
I've never worked somewhere before where people have been so close and have each other's backs and are looking out for each other as they do here. It's very reassuring, and that's a daily reassurance that I get.
Well, thank you for that. Do you see yourself at any point in your career ever changing locations from what you do now maybe to more at the bedside? Is that something that you're thinking about?
Very much so. I would like to be on the clinical side. That's something that I'm very much thinking of.
What are you thinking about?
I'm thinking of going to nursing school.
Excellent.
Maybe PA school. Just some options, but I think nursing is what would be the best fit for me.
Have you heard of Albany Med's Grow Your Own program? I
have heard of it, and I did meet with the representative from that program. It's kind of a no-brainer. Like, why wouldn't you want to do that? It's an amazing thing that Albany Med offers.
And for those who don't know, Grow Your Own is a program where we take our employees who are interested in going to nursing school. It's a partnership with Key Bank where some of the costs are underwritten. And after completing nursing school, they stay and work here with us, which is obviously part of our retain and recruit and retain efforts. So that would be wonderful for you. It would be wonderful for us. What are the sort of things you like to do outside of work? What are your out of work activities?
I love hiking just because it's great exercise, but you don't really feel like you're exercising.
Right.
You're outside and nature, and I think that's so important to connect with.
Do you
humans,
go up to the Adirondacks? Have you hiked any of the high peaks up there, or is that a goal of yours?
It actually is. It's funny you say that. I'm working on those right now. I'm only at 3 for 46 right now, 3 out of 46, but I want to be a 46er.
I do too.
Yeah.
Yeah, maybe we'll time it. We'll do it together.
Yeah, that would be great.
There's a lot of people at the medical center who are knocking them off, some who've done them all. So that's great. Maybe some people watching this will reach out to you and do some peaks together with you.
I hope so.
Well, Matt, one of the reasons we wanted to profile people we work with is we think that every person is valuable. Every member of our workforce is important. It's fun to get to learn about them one-on-one and share the stories they have. I think yours is a great story. You're coming to Albany Med after a career that was not in the hospital. You're here now. You're an incredibly important part of our team. You're somebody who potentially might change roles but stay with us in a different role in the future. And I thank you for that. And I thank you for everything you do down in the emergency department, which of course is near and dear to my heart, but really other parts of the hospital, everybody who does that first patient contact, so incredibly important.
Well, thank you. It means a lot to hear you say that. And I want to take the time to thank you as well. I mean, I can't even imagine coming on and starting this new position and then a huge pandemic hits. I have to say, not only how I feel about it, but hearing what other people say, it's very reassuring to know that you are kind of at the helm of things, and I think you've done a terrific job.
Matt Phelps, emergency department, potential future nurse or physician assistant with us. Thank you very much.
Thank you so much for your time.